as good as 20 to 50% of people struggle with depression at some point in their life. So how do we recognize depression? For this, I'll take you through a typical case scenario. A 25-year-old lady who comes sort of from the Somali family. She's married for 5 years, living with her husband and his family. Lately, her husband has been having some job difficulties, which is causing a lot of marital stress. And also the family is upset that they did not have any children yet. Slowly, the lady started feeling very shameful about it. She started isolating herself. She thought she deserves it, and there is nobody to help her. She lost interest in food. She's not sleeping well, and has been having thoughts that better she was not born, or wish she was dead. She knows that the life is God's gift and she shouldn't be doing it, but feeling very sad about it. What comes across is like a common reaction when someone doesn't have children or having financial worries. But if we closely look at it, not sleeping well, not eating, feeling sad all the time, feeling tired is what we call depression. Once we know that someone has depression, the first thought that comes to anyone is like, don't I deserve it? Yes, we appreciate that we all come from different religions and culture, and we commonly attribute depression to God's wish. But depression is like any other medical illness. Like if someone in the family has diabetes, we encourage them to stop eating sweets, take medications to get better. Depression is the same. It's caused by a combination of some life stressors and chemical imbalance in the brain, which causes it. What do we do? What are we supposed to do if we have depression? The first thing is, apart from our own selves, the family who live with us can realize that we are going through depression and encourage us to see the doctor. Sometimes we can go to organizations like ISRON to get some help because they're well aware of these problems like depression. Simple things like exercising, healthy eating are very good ways to start treating depression. But if you don't feel better with it, you can always see the doctor who can prescribe you a pill. And I just want to make sure that the tablets given to you are not part of any research or anything. Lots of people use it and they're safe to use it. Apart from giving pills, you can also see a counselor who can spend some time with you on week to week, who can talk to you about your difficulties and help you to solve your problems. Also, when it comes to social problems, you can come to the organizations again like ISRON, where they help you to solve your problems. The last question is, okay, I take my pills, I go to counseling, I go to places like ISRON, is it going to solve my problem? Is it going to give me kids? Unfortunately, we can't solve the problem, but we can give you the strength to solve your problems. And that's the reason we recommend you to get help for depression. The sooner you get it, the better it is treated, and the happier you will be, and the happiness will return again. I would like to again thank you, the ISRON organization, and everyone for giving me this opportunity to talk about this depression. Thank you.